This particular segmental hypermobility test is performed at L5-S1, L4-5, and L3-4. Now we're going to perform segmental anterior-posterior translation in side lying. This is a test for the detection of segmental hypermobility in the lower lumbar segments. For this test, we want the patient side lying. We're going to place the hips and knees in about 45 degrees of flexion to begin with. I'm then, on some women, you may want to put a small towel roll under their waist to support their hourglass shape. In the case of my subject, it's not necessary. I'm now going to position myself with the patient. I place the ventral aspect of my hip and pelvis on the left side against her knees. I am then going to place my index finger in the L5-S1 joint space. I'm going to place my middle finger over the dorsum of L5 because that's going to serve as a force in the test. My left hand will be placed over the sacrum in this fashion with my forearm against the thighs. But prior to getting in that position, with my index finger in the L5-S1 space, I'm going to reach down, grasp the lower extremities at the malleoli, and then I'm going to flex the patient's hips in this fashion, reciprocally flexing and extending and detecting here the midpoint of the range of motion of the segmental flexion for L5-S1. I may need to temporarily feel L4-5 above in order to know when it begins to move. Then I know I'm at the end range of L5-S1 flexion. I go back into extension, and then I go to a mid-range point. Then I resume the position that I described before. Index finger to interspinous space, middle finger to the dorsum of the spinous processes. I now will place my hand, as I suggested before, over the sacrum here, my forearm to her thighs where I'm, for lack of better terms, hugging the thighs. And now what I'm going to do is with my left hand, I'm going to provide a slight counternutation force where I'm asking the sacrum to tip backwards, where the apex moves forwards, the base tips backwards. Now I'm not going to actually cause a movement, but I'm going to create a force in that sacrum. I am then going to provide a ventral force with my middle finger over L5, while I'm going to use the index finger as a feeler gauge to detect anterior-posterior shearing in the segment. With this counter nutation force applied to the sacrum, I am now going to use my left pelvis and hip to load the femurs axially. I'm going to create an axial force up through the femurs here in this direction. So there's my counternutation. I put the counternutation there because as I load, I don't want the pelvis rotating anteriorly. So this slight force attempts to purify the translation of S1 on L5. So I apply the force, load with my middle finger, load L5, detect motion with my index finger, and now as I load the femurs, I'm pulling forward with my middle finger on my right hand to try and get L5 to translate ventrally. And then I'm going to let off the pressure and at the same time pull forward with my left hand and allow the L5 to spring backwards with my right hand in this fashion. I repeat the test here, and then I let go. And I repeat, and I let go. Every time I let off the axial pressure, I pull forward with this hand. And in so doing, what I'm trying to do is get S1 and L5 to toggle back and forth in a transitory fashion. We should not feel appreciable movement in that segment in the normal individual. However, if they have increased hypermobility in the sagittal plane, we'll feel, with our index finger here, we'll feel the segments translate on one another in this fashion. We can repeat the same test, instead this time higher up at L4, L5. In order to do that, we place L4, L5 in its midpoint position between an extended and flexed position. Once again, our hand is over the sacrum and L5. My index finger is in the interspinous space, and my middle finger is over the dorsum of L4. I provide the same counternutation force. I axial load the femurs while I pull ventral with my right hand's middle finger on L4 this way. The higher up you go in the lumbar spine, the greater tendency the axial load has to produce a rotatory movement. And so you have to work a little harder to try and purify the translation this way.